eyelid spasm or blepharospasm. Video contents. 1. What is eyelid spasm? 2. Symptoms. 3. Causes and risk factors. 4. Diagnosis. 5. Therapy. Blepharospasm is a type of focal dystonia. Dystonia is a motor clinical syndrome accompanied by continuous contractions in a group of muscles, so that these contractions lead to distorted and repetitive movements with strange positions in the limbs, neck or entire body, leading to difficulties in standing and walking to the point of falling. These movements appear and intensify when they perform movements that trigger these same muscles, and may even appear, in acute cases, even at rest time, in cases of sleep and lethargy, as fixed posture, at which point the patient is bedridden and does not perform his or her functional functions. This syndrome has been known since 1908. Since then, many experts have tried to describe the disease, in all its complexities. Dystonia appears to be placed in individual muscles, focal dystonia, or at one end, in the neck, 6/neck torticollis, in the face, especially in the muscles of the eyes, eyelid spasm, blepharospasm. In involuntary eyelid spasms, muscle contractions that close the eyes occur as a reaction to any light stimulation, especially when exposed to the sun. In such a case, a person needs to use his hands to open his eyes, to put on sunglasses most of the time, and sometimes, as a completely blind human being, he needs to be accompanied, guided and unable to drive. Eyelid spasm does not affect the quality of vision or the mental abilities of the patient. The only time vision is damaged is when the eyelid muscles close, requiring a physical effort to open them. Symptoms of eyelid spasm. Symptoms of eyelid spasm, blepharospasm. A strong feeling of shrinkage in the eyeball. Eye quivering and trembling, this may be an early sign of involuntary spasms in the eyelids. Blinking is fast and frequent. Irritation and dryness of the eye. In parallel with involuntary cramps in the eyelids, other symptoms may also appear, such as involuntarily open the jaw and close the jaw muscles. Shrinking lips and tongue erection. Causes and risk factors of eyelid spasm. The real and precise cause of involuntary eyelid spasm is still unknown, but a variety of conditions are symptoms. One possible theory that attempts to explain this phenomenon is that the functioning of the basal ganglia in the brain is abnormal. This privileged area monitors the start and continuation of voluntary and involuntary movements, for example reflex. The source of confusion in the basal nodes is unknown, but scientists believe that this confusion often plays a major role, and genetics has no significant role in the genetic transmission of involuntary spasms in the eyelids, from generation to generation. Diet and physical effort, for example, have an effect on involuntary cramps in the eyelids and can cause seizures. Involuntary cramping in the eyelids is not a life-threatening phenomenon, but it is a chronic and persistent disease that can appear at all stages of the patient's life. Diagnosis of eyelid spasm. Eyelid spasm is diagnosed by a neurologist or ophthalmologist. Diagnosis of involuntary eyelid spasms is often difficult and problematic, because it is very rare for the doctor himself to be an eyewitness to a seizure. Diagnosis is usually made through the patient's medical history. Diagnosis is often made by electronic means that record and document electrical activity in the eye muscles and help to achieve the correct diagnosis. Treatment of eyelid spasm. Treatment of involuntary spasms in the eyelids includes three main pathways: medication, Botox injections, the most effective and effective method of the three methods, or surgery. Any of the three methods can be adopted separately, or merged together. Botox injections allow for weakening and neutralizing muscles around the eye. This slightly weakens muscle contraction and allows patients with involuntary eyelid spasm a greater degree of control over opening and closing eyelids. The injection process is carried out through electromyography (EMG). Special electrodes allow the isolation of the area causing the problem in the muscle and the implementation of a concentrated and effective injection. We have reached the end of the video. If you have any idea for the upcoming videos, or criticism for the development of the content, do not skimp on me and write it in a comment and I will be thankful to you.